Hi, Dr. Travis Rose here from Peak Form Health Center, and we're with our patient today, and we're going to be looking at his overall posture of his mid-back and his neck, see what that looks like, because he's been getting a lot of tension type headaches that wraps around all the way towards his temples, top of the head, and even the back of the neck. So we're going to take a look at his posture, see where his head is aligned with the rest of his spine, and then we're going to go through some adjustments and some other therapies in the office here that we can do to help improve some of the headaches that he's been having. Okay, so now we're going to take a look at our patient here and just kind of get a look at his overall posture. So first I'm going to have him just go ahead and walk in place for me. So go ahead and walk in place. Keep walking, and then go ahead and stand fully relaxed. Okay, so we're going to just take a look starting at his pelvis area and then work our way up the back here. So he has a little bit of an accentuated curvature in his lower back, and previously on the exam we saw that he has tight hip flexors as well and a little bit of inhibition of the glute and hamstring muscles. So he has a little bit of an anterior pelvic tilt, and then with that anterior tilt here then coming up into the thoracic spine, he has a little bit of rounding into his mid back. And then looking at where his head's position is really not too bad, but his ear is a little bit forward compared to the tip of his shoulder here. So that represents a little bit of a forward head carriage, and that's going to put a lot of strain on the neck muscles here, the joints in the neck. And then these upper trap muscles are going to get overworked and fatigued from trying to pull the head back all the time. And he's been having a lot of tension type headaches again, wrapping up around towards the back of the head to the temple, and that's classic for trigger point referral of the upper trap muscles here. So what we're going to do, we're going to look at his back, see if we can do a few adjustments to get the joints moving a little bit better in these areas and address some of the musculature. And then afterwards, we're going to use some KT tape to help with postural reminders to where he should be holding his body after the treatment. Okay, so now we have patient face down here. We're going to do some palpation just to try to see where he is most fixated at in the spine. So we're just doing some generalized palpation, see if we can figure out where he has the most tension in his back. So right in this mid back here, real stiff joints. So this is an area that we're going to want to adjust to get those joints moving a little bit more freely. That will help with some of the local muscle tension, help with his postural alignment. So for this one, go ahead and drop your arms off the side here, both sides. There we go. Okay, so just to demonstrate what this looks like, we're going to get set up right on that tight spot in the spine. And go ahead and take a deep breath in. Exhale all the way up. And just keep blowing out, keep blowing out. Good. Okay. Feel okay?
Yep.
All right. So that's for the mid back there. So after palpating his lower back, we found a little bit of just generalized stiffness in the lowest part of the spine here. So we're going to do a few adjustments to address those areas. So going to get him all set up here. Go to reach forward there. Put this one right on the arm there. Good. Stay nice and relaxed here. Let me roll you this way just a little bit, getting set up on the lowest part of the spine here, and then go ahead and take a deep breath in. Exhale all the way out. Just stay relaxed. Good. Okay. The last area we're going to check out for our patient with the headaches here is that we're going to feel for the joints in the neck, and then we're going to feel around the muscles where there's a lot of tension in these upper trap areas. So again, we're just kind of palpating, checking out the range of motion of his neck, seeing where the joints are. We actually got a little adjustment into the tight joint there. And just checking it all out, see where he needs to get adjusted here. Okay, so there's a little bit of tension in this lower part of the spine of the neck here. So for this one, go ahead and take a deep breath in again. Exhale all the way out. And stay nice and relaxed. There we go. Feel okay? Mm-hmm. Okay. Now for the muscles around the neck here, what we're going to do is just take him through a little bit of shortening and then lengthening of these muscles. It's a little intense at times, but we find good results when we use quite a bit of pressure into these muscles here. Doing okay with the pressure?
Mm-hmm.
Okay. So we'll do a handful of passes on each side here. And it is important to note when we are working through these areas, and if headaches is one of the main complaints coming in, that when we work these areas that are causing the headaches, that it's very common for patients to actually experience a little bit of a headache right after the treatment because we're breaking down some of those tight tissues again that are causing the headaches. Doing okay?
Mm-hmm.
Okay, just a couple more. Good, and go. Okay, good. Okay, so now we're going to use a little bit of this RockTape or KT tape, and we're going to help promote proper posture through the upper back and neck here to help with the headache symptoms that our patient's been having here. So got a few different strips. And the first one, we're just going to help with the neck posture here. So we're going to put a little bit of a strip up top here, no tension. Then we're going to just give a little bit of a tug and pull it down the middle of the back, and then no tension to finish. And just rub it so that then the tape stays put. Second strip, we're going to do the same thing. Put it right up top there, and then give a little bit of tension, about 75% or so, laying it down, no tension down at the bottom. So this is going to help promote more of a upright position through the neck and head here. Pull the ears just a little bit closer towards the shoulder, and then if he is starting to creep into what we would consider poor posture, forward head carriage like that, tape's going to just give a little bit of a tug, so a little bit of a postural reminder to keep his head back over the shoulders in the proper posture position. And the last thing we're going to do here, we're just going to do one side for demonstration here. Turn that way, neck, thank you. Just to help with the upper back and the shoulders here, we're going to put a piece of tape on the side there. Give a little bit of tension here. We're going to follow this lower trapezius muscle fibers that are a little bit inhibited on our patient here due to the overactivity of the upper traps. We're going to pull it down, and no tension going down towards the spine like that. And again, that's just going to give a little bit of a tug to keep the shoulder back, a little bit more in alignment. And then if he gets into a rounded shoulder position, the tape's just going to give him a little bit of a tug, so he reminds himself to then keep the shoulders back. So go ahead and turn and face this way again, and then just kind of shake that all out. Just stand nice and relaxed, and just kind of see how that feels. Okay. So it looks pretty good. Again, mainly just to remind the patient of proper posture through the neck and the shoulders, and it looks like there's a little bit better alignment of his neck, shoulders, upper back area.